Appendicitis is inflammation and infection of the appendix, a small, worm-like growth located at the beginning of the large intestine, on the lower right side of the abdomen. If you have a sharp and persistent pain in the lower abdomen, near the belly button or farther to the right, the pain gets progressively worse, usually over a period of 6 to 12 hours and accompanied by fever or vomiting, loss of appetite, diarrhea. Go to the emergency room. For a long time, it was believed that the appendix had no use. We now know that it produces antibodies, also called immunoglobulins, like several other organs. It therefore plays a role in the immune system, but since it is not the only one to produce antibodies, its removal does not weaken the immune defenses. Appendicitis is often the result of an obstruction of this small anatomical structure by feces, mucus, thickening of the lymphoid tissue present. It can also be caused by a tumor that obstructs the base of the appendix. The appendix then becomes swollen, colonized with bacteria, and may eventually begin to become necrotic. Only surgery can treat an appendicitis attack. The classic operation is to remove the appendix through an incision a few centimeters near the right iliac fossa, a few centimeters above the groin, and thus remove the appendix, this method which presents less risk of post-operative infections. The surgeon can also proceed by laparoscopy, by making 3 incisions of a few millimeters in the abdomen and inserting a mini camera to incise and remove the appendix with the least possible damage. In the case of an operation by laparoscopy, the 3 small holes become almost invisible a few weeks later. For a classic operation, the incision of a few centimeters, very fine, becomes barely perceptible over time.